Mental Health Issues in Children Living in Low Economic Status by Graciela Villalta-Lagosis, BECE 4th year graduating student. Background of study. Working as an early childhood educator allows for some insight into issues surrounding children and youth in Canada. Specifically in my hometown of Hamilton, Ontario, I currently work as an ECE in a low-income area. During my schooling at Mohawk College to complete my early childhood educator diploma, I did some placements in a higher income area. Comparing my experiences in working in a high income to low income area, I noticed a few significant differences. With these significant differences, it led me to ask, why? The purpose of this thesis project is to study to see if there is a correlation between mental health disorders seen in children and its rise, and if their income has any connection towards it. This study will help early childhood educators understand the various factors that connect low-income families to children having behavioral or mental health issues. This study is important to educators who may work in programs with children with mental health or behavior issues and community partners to better support the children and families in these areas. This study could also be used to support the development of curriculum for different needs of children and understanding the children's behavior and mental health issues further and understand where they may stem from. The mental health of children in poverty areas in Hamilton, Ontario, and other parts of Canada is significantly rising. As said by Belfer, the immense mental health issues in children have been on the significant rise, especially in areas lacking resources where it is difficult for individuals to define what a mental health disorder is. Mental health issues in the early years of childhood development without some sort of support or proper care can have lasting effects on childhood. As said by Gunn et al. 2020, mental health conditions experienced through life commonly manifest symptoms before adulthood. About half of common mental health conditions, such as mood disorders, anxiety, and impulse control disorders, display symptoms before the age of 14. Some children may have parents or guardians who have mental health issues or behavioral issues that have not been addressed properly or diagnosed. The child's mental health issues may be learned behavior or genetically passed down. Bandura's social learning theory states that a child's learning and development comes from modeling and observations from individuals and community around the child. Children modeling others is not limited to behaviors, but can also include others' emotional reactions and attitudes. Both cognitive and environmental factors determine how children learn to behave. Children model their parents greatly, as well as others highly involved in their lives, and the modeled behavior may be acted upon or copied. The image to the right is Bandura's social theory. More so, when doing research on the social learning theory, the cognitive model was more so modeled in this thesis and used for the study. There is much literature on the topic. There isn't much significant specifically to Hamilton, Ontario, but there is much related to children in Canada. One article listed, Child and Adolescent Mental Disorders, the Magnitude of the Problem Across the Globe, discusses results from WHO, and discusses how there's resources to better create and implement child mental health services. This resource discusses the diagnosis and challenges of diagnoses in children and youth. Social Assistance Trajectories of Children Mental Health Problems in Canada, Evidence of the National Longitude Survey of Children and Youth, discusses the various trajectories of children growing up in poverty and having mental health issues that pertain to it, as well as discussing connections that link growing up in poverty to mental health issues. This resource also discusses looking into the connection of stability and instability in the social assistance programs in Canada, as well as mental health issues in children living under social assistance. And finally, mental health service urgency in children's mental health, factors impacting the need for expected services. This article discusses the issue of delayed access to mental health services for children and youth, and due to the delayed access, the harm towards urgency of children's mental health. This article emphasizes the issues surrounding children who may need urgent mental health service and the different issues surrounding the Ontario healthcare system regarding children's mental health. For the design of my study, I used the qualitative and quantitative research approach for my topic, as this is a mixed method of approach towards my thesis, consisting of examining the ideas and feelings towards a topic, developing an understanding of my topic as either a phenomenon or a problem, finding the cause and effect between poverty and mental illness. The information researched and data collected to support my thesis consisted of different written answers and analysis towards my topic, or also provided statistics to help support the solutions or research found about my topic. I intend to find the cause and effect of poverty and mental illness in children, as well as find the understanding of the effects of both on children. I used classic systematic literature review for my thesis, as it is a type of constant analysis focused on academic literature, as most of my articles are other research articles, and allows for reviewing the literature in a systematic way. Using Brock University's Omni database, I used multiple forms and phrases to find research items to use. Different terms such as children's mental health effects on children, poverty affects children, etc. The search terms have allowed for the search of articles that relate to my purpose of study, allowing for information to be collected in relation to my focus of study and be organized to become topics and information further on. In my research, about 15 to 20 peer-reviewed articles were analyzed to collect data regarding my chosen topic. There were various themes in my research, mostly pertaining to my topic, but also some themes that were able to expand my topic further. Some themes seen were discussion of the number of children who meet the criteria for mental health issues, as well as children who fall into the label of poverty. Themes for the increase of mental health issues in children, as well as how the effects of poverty have developmental effects on children. The demographic for my research was children and adolescents between ages 0 years to 18 years, depending on some sources. As it was very difficult to find results solely focusing on early childhood development, most, if not all, findings will represent the demographic of 0 to 18 years. Some findings are: levels of children and youth mental health problems are high in Ontario and have increased among the ages between 4 and 11 years old compared to 30 years ago. Between 18 and 22% of children and youth in Ontario meet criteria for mental health disorders, but less than 1/3 had contact with a mental health provider or doctor. Low income is associated with low parent investments of time and money in their children's learning. Material deprivation more strongly predicts parenting stress and harsh or unresponsive parenting in children's social and emotional development. Across many studies, poverty is associated with a range of negative outcomes for children in the realms of physical health, language and cognitive development, academic achievement, and educational attainment. There is evidence that the conditions of childhood may have lasting influence through, as childhood SES, socioeconomic status, was found to predict increased cortisol output in healthy adults, and this association was dependent on current SES, perceived stress or lifestyle practices. The image provides information with associations of early life poverty, discussing impacts on child biology, impacts on child's health and developmental outcomes, as well as long-term implications for adult health and well-being. In doing my research to answer my question if there is a correlation to mental health issues in children and their level of economic status, there are many aha moments. As an ECE in a low-income area, it was able to support the questions I had related to my own workplace. My study had supported the literature about my chosen topics, as the literature was able to support my question and provide answers to questions researched for my topic. There is much valuable information that came out of my thesis study that is able to be related back to my workplace or for other ECEs to use in reference. No One Left Behind has stated that over 1.3 million children in Canada and over 550,000 in Ontario live in poverty. Furthermore, children modeling others is not limited to behaviors. As mentioned before, emotional reactions and attitudes can be copied, as well as both cognitive and environmental factors can determine how a child behaves. A very interesting thing found in this study that stood out was that immigrant families generally come to the United States or Canada with a number of strengths, including good physical and mental health, a strong sense of family correlation and obligation, high levels of parental warmth and nurturance, low levels of harsh discipline and hostility, and a high value placed on education. These positivities in these families, combined with expectations of upward social economic mobility and a better life, may override the negative effects of childhood development outcomes of transcendent social disadvantages. As an ECE working in a low-income area, my coworkers and I have experienced different children with mental health issues and behavioral problems enter the child care center. With these experiences and now having more research to support my questions, there are different recommendations for educators and parents to take away from this study. One takeaway would be having increased support during a child's care or school hours if needed, such as if a child may require extra assistance or if they are disrupting the group, or known to disrupt the group. This support should be someone who specializes in working with children with mental health issues. Funding should be allocated towards this support. To continue, parents are encouraged to listen to any concerns brought up by doctors or educators regarding their child's development, as if they do, they can reach supports for them to have and help with any mental health or behavioral needs. If a parent is struggling with issues themselves, center or school should provide more resources such as parenting courses to help support more positive behaviors from the parent, as it greatly affects the child if they come from a low poverty family. These issues could stem from the parent, and this could be due to a parent's low education or low understanding of child development. Next, there should be stronger support in place for children's mental health in child care centers and schools. This will help support a child's needs and assist the family with other resources if needed. For example, my workplace works closely with Community Living Hamilton, where they provide resources for families as well as support for families with children who may have mental health issues. To end, I leave you with this. With nearly 14% of children in countries such as Canada experiencing emotional or behavioral problems, and a few accessing specialized mental health services, identifying opportunities to prevent them at the population level is an important international policy focus.